California took swift action last March as the coronavirus pandemic reached the U.S., locking down much of the state, including businesses. But essential services like groceries, hospitals, and pharmacies were allowed to continue, putting those who staff those jobs most at risk.
People are really anxious and worried about their families.
They started showering at work.
My stomach is in knots, like all day, every day, but you gotta go to work.
Over the last year, we told you about the deaths of employees who contracted coronavirus at places like the Tracy Amazon Fulfillment Center and a Safeway Distribution Center, where dozens of employees tested positive.
This is a serious issue, and it requires a serious response.
Last spring, state and federal lawmakers began taking action meant to protect essential workers during the pandemic. Ted Samara is the executive director of the union representing most of Sacramento County's 2,200 employees.
The state did great in regards to implementing emergency orders to protect, the working class, the workers.
Lawmakers mandated employer-required sick leave for those who got sick or had to quarantine due to exposure. Disability benefits were expanded for up to 52 weeks for those sick or quarantined because of COVID. Guaranteed paid family leave for those unable to work or caring for someone who's sick with the virus. And they provided unemployment benefits for those who lost their jobs or hours due to the pandemic. Despite efforts by lawmakers to keep essential workers safe, many have fallen ill and some have even died from potential work-related exposures.
When my brother started having cold symptoms and probably Latino family, you don't go to your doctor, you don't call, you think it's just a cold, you can't stop working because you can't afford.
Isabella Marinon's brother, Javier Lopez, a 59-year-old Sacramento restaurant employee, continued working until he was hospitalized with coronavirus. He later died. According to state data, case rates are disproportionately higher, by 38% in communities with a median income of less than $40,000 per year, state officials say, where grocery, healthcare, and cleaning service workers live.
For those workers and their families that this coronavirus has taken a toll on them, for the losses that they suffered, those are the losers.
While vaccines are now available and things appear to be getting better, Samara urges caution in the months ahead.
Taking it a little slower. Let's not rush into this. We understand eventually we're going to be back at full capacity, but we don't have to be there tomorrow.